Crystal shows collaboration daily in her duties in administration. She works closely with all departments within our facility, doing the payroll, scheduling shifts, taking minutes at meetings.
We have to work as a team to get everything done. We all want the best for our residents in long-term care and at the lodge, and so we all have to come together and help each other.
We see her as a very key player in the team at St. Mary's. We think she's a champion. She's #1 to us.
December 22nd, we had a flood in the kitchen in Mundare, which rendered the kitchen unusable for an extended period of time. The food services staff and the FME staff, and we also collaborated with the St. Joseph's Hospital kitchens to ensure that we had the hot meals provided.
Working together, it went through very easy and we accomplished lots.
The residents said it was a great Christmas supper and they didn't notice any difference at all.
What motivates me to collaborate here in this hospice unit is like the people who I work with. They all are very hardworking and compassionate people. We use every other team member's suggestions, opinions. They are all valued, and we try to create a care plan and implement that. When you work as a team, you have a really positive work environment.
She is very dedicated to her job. She doesn't mind to stay longer, and she very good mentor.
Greg works with every single department in this facility. He's the go-to man. He's our Hollywood man, as we call him. He knows everything. Greg takes great pride in the service that he delivers at the hospital here and demonstrates exceptional initiative and commitment to meeting or even exceeding the expectations of staff.
Collaboration, I think, creates efficiency. It also creates some harmony in the workplace.
You will find Greg pounding the pavement to ensure that we have a safe campus for all that visit or who stay here.
It's a hospice program that we started here in Bonnyville. Quite often in rural communities, physicians are required to take care of their own patients in hospital 24 hours a day, 7 days a week, through the whole year. How it works, in essence, is every morning the physician gets together with a nurse on the floor and with a pharmacist and with occupational therapists. They review each patient quickly, and then they also give each other feedback. It's a sustainable program. It looks like it's going to keep going, and everybody seems to enjoy it.
Krista's name always comes up whenever there's a new project or initiative that needs to come into place. She was also integral in our Path to Home implementation. I think it was just her rapport and her relationship that she has with the staff and physicians, that they respect her opinion.
Collaboration to me is communication in a multidisciplinary team, provide the best possible patient outcomes, not only just for patients but also their families.
Collaboration is communication.
Linda shows collaboration in her everyday work by soliciting feedback from the staff, from myself, and from the families, and being proactive in how she approaches her interventions.
Other people's opinions can actually make something more vibrant, and you can get a better scope. You truly want their opinion, you truly want their creativity.
She's very easy to work with and always looking for input from the people that she works with.
I have an ongoing collaborative relationship with a group of professionals in Covenant Health called the Clinical Safety Coordinators. I work with them sort of as the liaison between the corporate world of occupational health and safety, quality, disaster management. We discuss ideas. That opportunity to collaborate happens almost daily.
She is collaborative in everything that she does, and Lynn approaches that, whether it's with the people at Killam Health Centre, committee work that she does, learning and working with everyone.
July 5th is a very different scene. As these ceilings opened up, water poured into this facility and destroyed all of the sterile supplies of the hospital.
We lost this entire warehouse. It essentially meant within hours of the event, we had people from the Grey Nuns Hospital, people from AHS, people internally from other departments, including senior leadership, people from the operating room, as well as our own internal team, all coming together to put a plan in place and activate a plan that would get this place back up and running within 5 days, which is essentially unheard of.
We have an expanding program here for our MDRD department. We were working on our accreditation and realized we needed a bit more help than what we could manage on site. The great thing was Oliver came in, rolled up his shirt sleeves and dug in and worked right alongside of the staff.
Just being able to share some of our expertise, some of our learnings from our audits and our accreditation process out here.
And Lan was excellent at getting all of the SOPs sorted for our department. She had written them and then we modified them for what worked for our hospital. And the team was extremely proud of all the work that was done and the support that they got from both Lan and Oliver.
Melissa really has been the backbone to our stroke unit equivalent care and early supportive discharge team here in Camrose, and they have won on a provincial and a national scale recognition for the program.
So we have really had to be purposeful about collaborating with all of our community partners to really make sure that everyone knows what the project is about.
It's easy to find good players. It's really hard to make them work together, and I think Melissa really does personify that in everything that she does.
Collaboration is something that the memory care team focuses a lot. One of the things that I always learn from them, and I'm learning all the time, is that they ask questions and they involve other team members to make sure they make the best decision to deliver the best care for our clients. They always involve again other team members. That includes OT, physio, pharmacy, home care. That way they can come up with the best solution, which is to deliver the best care for our client.
I see collaboration as working with one or more individuals, forming a group and working together.
Nina comes to work every day with the purpose of helping someone. She's collaborated with a group that comes in to assess our patients on acute care when they need a different level of care, and she collaborates with the community groups and has actually established a weekly meeting. They come together, make decisions. It just means a better outcome for the patient.
Everyday occupational health and safety has to look after the health and safety of our employees. It's our most valuable asset in the organization. They collaborate with multiple different departments as well as organizations external to Covenant Health to ensure this occurs.
I really feel like that's such a big part of what we do, is creating those relationships throughout all of the different areas in the hospitals, be it the frontline staff, the support staff, the managers. It makes you feel like you've done something right when you have that kind of easy and open line of communication with staff at all different levels.
The clinical leads work with a variety of people, including physicians, patients and family advisors, as well as the frontline staff and interprofessional team that they are involved with. They specifically ask the input of all the stakeholders to ensure that they're represented in the model itself. I felt that they were really collaborative when it came to working with the mental health core design team. It's a specialized population. We really didn't want to have a cookie cutter approach to mental health, so we were very, very focused on making sure that the work in mental health was successful.